Hi, my name is Dr. Cara Curtis. I'm here at ProHealth Chiropractic in Calgary, Alberta, and I've done a quick video for you today on how to foam roll your entire body. This routine takes about 10 minutes. I teach it to all of my patients, and I make most of my patients, if not all, purchase a foam roller for at home. I always joke to them, if everyone foam rolled and did yoga every day, I probably wouldn't have a job, but people don't do that. So I'm still here and I'm teaching you this so that when you're at home and you can't get in to see me or you can't get to a yoga class, you can use your foam roller. It's a very inexpensive piece of equipment to have. It doesn't take up a lot of room. A lot of you probably have one hidden in your basement. So dig it out and follow along with this video. This is going to help decrease pain. It's going to help promote joint motion. It's going to increase your posture and overall mobility in the spine. So we're going to begin in the mid-back, the thoracic spine where your rib cage is. So I want you to come down onto the foam roller, find where your last rib is, and that's where we're going to start. You're going to lean back onto the foam roller, plant your feet, place your hands behind your head to support your head and neck, and then you're going to lift your hips. That's going to allow you to freely roll back and forth. Now you shouldn't be doing a strong abdominal crunch during this, and you don't want to do too wide of an area. It's going to feel really awkward. So you just want to relax, arch your back over the foam roller, and let gravity do the work for you. So as you can see, I'm kind of inching my feet away from me as I move the foam roller up. This will allow you to go higher up the spine in small increments. Okay. Then once you feel like you're about to roll off the shoulder blades, just do so. Come all the way down onto your neck. And this part's really nice. You just get to lay on the floor and nod your head yes and no. The foam roller should be pushing into those muscles right at the base of the skull, and just gently roll back and forth, nodding yes and no. You can turn to one side and then nod to target one side or the other. Okay, now we're gonna move on to the lower back. Real quick, you never wanna roll all the way directly on the back straight. You wanna go a little bit off onto your side, just to protect the low back, and it feels a lot better. It'll be really uncomfortable if you go straight. So, in this position, forearm down, one leg straight and one leg bent, and then you're going to lift the bottom hip and roll in that groove right below the bottom rib and the top of the hip. Okay, that's a nice squishy spot. So again, slow and controlled, and a small area, just about the width of the foam roller. Okay, moving on. Now you're going to drop down below the bone of the hip into the glute muscles. Okay, now you're in the hips, and again, slow, controlled, find those tight spots, work them out. Now there is a muscle more towards the front of the hip. Now in order to target that one, you bring your back leg to the front and lean a little bit more to the front of that hip. You can spend a little bit of time here and play around with it depending on how tight you are. And then bring that back leg back again, and now you're back in the glutes. All right, now you're gonna come up onto the foam roller, sit up nice and tall, take that leg, cross it over. This is a figure 4 stretch. You're gonna sit up nice and tall. You're gonna lean to the side where that knee is bent, and then roll back and forth. This one feels really good. This one's getting into your piriformis muscle. So you're stretching and foam rolling at the same time. Okay, and now I usually just switch legs. So you're gonna switch, and then you're gonna go back up the other side. So nice and tall, lean into that side. And then you're gonna go back down onto the ground. We're gonna go back up the other side. So glutes first, top of the glute, back and forth. You can play around with rolling a little bit more to the front. That little muscle is called the TFL. And then again, back. And then you're going to drop down above that hip bone, below the rib. This is your lumbar spine. This muscle is called the QL. Okay. And once you feel like that is relaxed, you can move back on. And I always recommend just redoing the thoracic and cervical spine, okay? So one more time. Roll and arch, roll and arch. Work your way up, inching up, 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 up. And you can end with the neck. Relax and nod. Great for headaches. And that's it. I hope that that instructional video was helpful. I hope that you learned something. Please use your foam roller if you have it, and if you don't have one, or if you have any further questions or concerns or need a little bit more assistance, please give me a call. My number is 403-547-9011, or you can look up Pro Health Chiropractic online and give me a shout.